Recorlev, levoketoconazole, is a prescription medicine used to treat high cortisol levels in adult patients with Cushing syndrome who cannot have surgery or who have had surgery that did not cure their Cushing syndrome. Recorlev is not to be used for treatment of fungal infections. Please see important safety information, including boxed warning for liver damage and heart rhythm problems, at the end of this video, and medication guide and full prescribing information for Recorlev at www.recorlev.com.
A friend gave me a tiny harmonica, maybe like 25 years ago, and it has become my jam. I can't play a single song, nothing, but I can toot on this harmonica, and I do. I'm always wearing my tiny harmonica. It just goes with me. Over the years, it's also been something I give to people.
My Nana is known as the harmonica lady.
I live with my daughter, Sibel, and my grandson, Hassan. Hassan came to live with us 5 years ago in 2020 after his mom, my older daughter, Yasmin, died and left Hassan behind.
Me and my Nana, we like to cook together. I overall just like spending time with her. You know, she has a lot of amazing stories to tell and a lot of experiences that you only ever hear in books or in movies.
Before I was kind of laid low by Cushing's, I was an avid walker. I was walking marathons, and I was walking about 80 miles a week. I was also cycling. When I was about 50 years old, I started developing some symptoms that just didn't make sense and didn't resolve, and couldn't understand what was going on. I had a buffalo hump that was building on the back of my neck. My weight gain, crazy weight gain. At one point, in 2 months, I gained 30 pounds. I had severe anxiety. Like every day was fight or flight. I had high blood pressure. I had a moon phase. I was just getting sicker and sicker and sicker. It was tough. I had to stop working. I couldn't even walk down the driveway, much less down the end of the block. I think that the most devastating symptom was the impact that it had on my mental health. I was being told for more than a decade, this is kind of all in your head, you're catastrophizing. The problem is your weight. You wouldn't have these symptoms so much if you weren't fat. I think I was first diagnosed with a pituitary tumor in 2010 or 2011, and it wasn't until 2023 that my endocrinologist started putting me through more comprehensive testing. After 3 months of test after test and scan after scan, my endocrinologist sat down with me and we talked about the fact that this was Cushing's syndrome. It took me 13 years to get a Cushing's diagnosis. When my doctor told me that there was a treatment, I didn't believe her. My endocrinologist said that Recorlev could normalize cortisol. My doctor told me that Recorlev can cause liver damage and heart rhythm problems, which are serious side effects. I started taking Recorlev in September 2023. I did experience serious fatigue in the beginning. I slept a lot. The fatigue was my only side effect. Of course, that's my experience. But within 6 months, my cortisol levels had dropped. Slowly over time, I started to see like a softening of some of the trademark features of Cushing's. I have a buffalo hump, but it's gotten kind of softer. And I had this like ginormous belly, and it's kind of changed a little. My blood pressure has gone down, and it's within a more normal range now. I have less fatigue, more stamina, more buoyancy in my being. I'm back to cooking regularly and not just like chopping an onion and that's it, I'm done. I can do dishes. I still can't clean the house, as anyone can tell you that I never could actually, but I'm doing more and it feels so good. Having my cortisol under control makes me feel like not only do I have a future, but it's a bright future and a useful future and a future with people I love.
Indication: Recorlev, levoketoconazole, is a prescription medicine used to treat high cortisol levels in adult patients with Cushing syndrome who cannot have surgery or who have had surgery that did not cure their Cushing syndrome. Recorlev is not to be used for treatment of fungal infections. Important safety information: Recorlev can cause serious side effects, including liver damage, hepatotoxicity. Some people who were treated with ketoconazole, a medicine like the active ingredient in Recorlev, had serious liver problems that required a liver transplant or led to death. Call your doctor right away if you have pain on the upper right side of your stomach area associated with nausea, unusual fatigue, yellowing of your skin or the whites of your eyes, or unusual bruising or bleeding. Heart rhythm problems, QT prolongation. QT prolongation can cause irregular heartbeats that can be life-threatening. Call your doctor right away if you feel severe lightheadedness or if you faint. Low cortisol levels, adrenal insufficiency. Recorlev may cause adrenal insufficiency by excessively lowering production of cortisol. Call your doctor right away if you have nausea, vomiting, dizziness, unusual fatigue, low blood pressure, unexplained stomach pain, abnormal electrolyte levels, loss of appetite, low blood sugar, or body aches. Do not take Recorlev if you have cirrhosis, active or poorly controlled liver disease, frequent stones in gallbladder, or history of liver problems due to use of a drug. Take certain medicines that cause QT prolongation or may affect how your liver works, such as CYP3A4 inhibitors. Have a history of certain heart problems, which may include one of the following conditions: torsade de pointe, ventricular tachycardia, ventricular fibrillation, or long QT syndrome. Are allergic to levoketoconazole, ketoconazole, or any of the ingredients in Recorlev. Serious allergic reactions can happen in people who take Recorlev, including rash, itching, hives, fever, swelling of the lips or tongue, chest pain, or trouble breathing. Recorlev may lower testosterone levels. For males, symptoms include breast enlargement and erectile dysfunction. For females, symptoms include low desire for sex and mood changes. The most common side effects of Recorlev include nausea, vomiting, low potassium, easy bleeding or bruising, high blood pressure, headache, liver injury, abnormal uterine bleeding, redness of the skin, fatigue, abdominal pain or upset stomach, arthritis, upper respiratory infection, muscle pain, abnormal heart rhythm, back pain, sleep disturbances, and fluid retention. Before taking Recorlev, tell your doctor about your medical conditions, medicines you take, and if you are breastfeeding or plan to. Recorlev may cause fertility problems in females and males, which may affect ability to have children. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information, see medication guide and full prescribing information for Recorlev at www.recorlev.com.